This video is going to walk you through our new updates to BirthTracks. So we have added a new section called pregnancy, along with the ability to add multiple births to one patient. So if you have a patient in which you've logged their birth in BirthTracks and they've now come back to have their second baby, you'll now be able to log their new pregnancy and birth under the same patient. You will no longer need to create a new patient profile for their second birth. So we're going to walk you through how to add a patient. Now, most practices will add a patient during their first OB visit. So they'll come here to patients and you would select add patient. And then you're going to fill out some basic information about this patient. And this information here is information that's not going to change with each pregnancy. So it's completely related just to the patient and not to the pregnancy. So for example, when was their birthday? Which will give you the patient's age, primary and provider, what their G's and P's were, etc. And you can always change these fields by coming up here to sort fields to move the fields around or delete fields. And if you want to add new fields, then you would come here to additional fields. Then you're going to select continue to add pregnancy. If for some reason you don't have the pregnancy information, you could always submit it without pregnancy and then come back later and add the pregnancy. So we're going to add the pregnancy here. And we're going to just put in some basic information about their pregnancy. So when are they due? What prenatal site? If we have the GBS, we can add it now, or we can always come back and add it later. And if they've transferred, we can select the reason that they've transferred antenatally. Once you do that, then it's going to move them into a different section here titled View Transfers, so you keep track of your transfers. Once you've entered your information, you're going to select submit, and then this is going to now take you to a new view of the patient's chart. Now, you now get the side navigation here, which allows you to toggle between the different types of information about this patient. So we have patient and pregnancy information, which is what we've already logged. We have not logged a birth yet, so that's why you see no records found. Now, once we log a birth, the pregnancy information will move into the birth section since that is related to that birth. This pregnancy tab here is only going to show you current pregnancy information. We also have some more information that's highlighted up here in the patient header. So right away you can see what their age was, what their date of birth is, what their obstetrical history is, their gestational age, and their due date. So let's say now that this patient is now 40 weeks and she's come in and she has delivered and we want to add her birth. Then you would log into BirthTracks, you would find her under View Pregnant Patients or the All Patients page, and you would click on her name, and then this would bring up her chart here, and then you would select Add Birth. Now this is going to bring you to the same form as before, where you have the ability to edit the patient information if needed, the pregnancy information. So for example, let's say now we know that she is GBS negative, we can change that there, and then we'll go through and we'll fill out the rest of information that's pertinent related to the baby and the birth. So we'll come down to the birth section here, and we're going to select she had a spontaneous vaginal birth and click submit. This will bring us back into the patient's chart so that we can now see her birth that has been logged, and that will be listed under births here. So if we log multiple births, then you will see multiple births under this births tabs. It tells us the date of the birth and then also whether it was a vaginal or a C-section. Now, let's say that this patient now comes back 2 years later and she is pregnant with her second child. So we would come back and we would select the patient. You could either find the patient under My Practice's Births or All Patients. You would just search for that patient and click on their name. And then this will bring you back into their chart here. And then you would come here to add pregnancy. And just like before, we're going to put in the patient's due date, and then any information that's pertinent to this current pregnancy. We'll then click submit, and then same as before, once she's had her baby, then we're going to click add birth and then add the birth information. So we'll go through and add the birth information quickly here so you can see how it looks once you've logged 2 births for a patient. And I'm going to change the day here to a different day. And we'll have her have a C-section this time so you can see how this looks as well. I just need to add the delivery provider under the baby section here. and submit. So again, this brings you back to the patient's chart. You're going to now see 2 births listed. So this is the most recent birth that she had. She had a C-section. And then the day before she had a vaginal delivery. And then again, we can click here. Now with the pregnancy, we no longer see any information here because she's not currently pregnant anymore. The pregnancy information that was related to this birth now is up top on this birth. And then on this one here, you can see this pregnancy information is related to this birth. If she now comes back for her postpartum visit, then we could also log her postpartum encounter by clicking on Add Encounter. And we have a separate tutorial video that walks you through how to use that feature. If you needed to edit, print, or delete, you could also do that here. And then again, if you ever want to change the fields that you're collecting, then you can always come to practice additional fields to add a new custom field, or use the sort fields page to move fields around or delete fields.